and or the proper training and a variance written into your operational plan. Accessing these aren't just something we do. We utilize it, they're there. I do know that many of us will be working in ERs or in critical care units and things like that, that could all change. So I'm gonna just quickly go over the 4 different types that I do know of here. All right. So the first one I have is the Hickman. And with the Hickman, you have double or triple lumen catheters that are available. And the entrance site's usually at the jugular vein. The catheter is advanced into the superior vena cava or into the right atrium. Then the exit site's located somewhere nearby in the same vein. Let's see what else it says here. It has 2 or 3 separate lines. The red lumen is used for tracking or for taking blood samples or for giving blood products, things like that. They're all color coded. White and blue lumens are used for giving medications, IV fluids, and then the medications and IV fluids can also be given through the red lumen if it's needed. So the big thing with this is a lot of these central lines, it's not normal saline as far as flushing and things like that. Patients with a Hickman really need regular flushes with heparin in order to prevent that line from clotting or being blocked by clots. So if any of you out there done anything with the Hickman catheter, what can you guys share? Anything? Well, that's...
I have not seen a Hickman in real life.
Okay.
We used to use them in the intensive care unit, and the big thing with any of these central lines, the Hickman, pick any of them, is you have to be real rabid with the air bubbles, because this is directly into the vena cava, and if you get an air bubble in there, it's going to go right. It can go right to their brain because it's not going to go through the. Some of them don't go through the lungs, so you have to be real rabid about not getting air in these things. So when you disconnect them, they have to be clamped because they'll draw air into the system very easily, especially the big ones like the dialysis catheters that they use. They clamp them before they unhook anything because it can the pressure of the blood flowing by can actually suck air into the system and give them a real big air hole embolus. So that's what I remember about, and that they have to be heparinized every time. So.
Coming into the emergency room, the biggest problem that people will come in with is if the cap came off or if the tubing broke at some point.
Cracked or sprung a leak.
Yeah, that's what the problem was, and basically for that, just clamping it off with some kind of a clamp and getting them to the hospital, because if the tubing is broken, then they'll need to have it replaced. If it's just as simple as putting a cap on, they can do that too, but like you said, it's just, you gotta be really careful, very conscientious of it.
I know they have repair kits at least for the grow shop.
Do they?
It's a little thing, they cut it off and it goes in, and there's a repair kit for it, because those tend to leak sometimes. They get a little pinhole.
So the caregiver would do that, or
No,
can
they
the
come to
person, patient,
the
the hospital has to do it?
Yeah.
Okay. Because a lot of our patients that are on home care, that's the big thing, and when we would see it is that they're actually homebound or live at home, and this is their access for when they go in to get their chemo or to get those different things. And then when problems arise, like Erica was saying, that's when you go there. That's when you're gonna have to deal with this and look at them and things like that. So anybody else have anyone with this one? Thank you.
The other thing too is if it is broken or if the cap has come off, and if you get called to the scene, grabbing, if you can find that piece